Hi, my name is Daisy Rosales. I am the co-founder and executive director of BRIO. We are a nonprofit that increases access to quality mental health support and training through design and collaboration with local organizations. Through our partnership program, we provide a mental health design process, consultation, evaluation, and leadership support to design community-owned models of care. And since 2018, we have worked with organizations in Ecuador, Mexico, Peru, India, and Malaysia.
Thanks so much, Daisy. Thank you for joining us. So can you tell me what drew you to social entrepreneurship?
So when I was 8 years old, I befriended a homeless girl here in San Jose, California, where I grew up. And even at that point, even though I didn't understand systemic inequality or really the roots of poverty, I recognized that she was a friend and that our friendship was based on mutuality. And for much of my life, I was looking for ways to contribute to the thriving and flourishing of people who are born into really challenging situations and realities. And eventually that path led me to identifying the mental health care gap as a big challenge facing some of the most vulnerable communities around the world. And with global mental health growing as a field, it seemed right for my co-founder and I to explore ways to really contribute. And we felt that social entrepreneurship was a good place to start, to ask questions, to partner with incredible organizations already doing the work, and to find ways to contribute and advance that work.
Thanks so much, Daisy. So what inspired the idea for your current venture, BRIO?
Let's start over. So over the years, we had gotten to know various community-based organizations in Latin America through volunteer work and through professional work. And one of the biggest challenges that they frequently mentioned were the contextual mental health challenges that their participants and communities were facing, and the lack of access to care or training or promotion programs that might mitigate some of those challenges. And so one organization in particular that we came to know very well was one based in Quito, Ecuador, in one of the poorest neighborhoods of the capital city. Their challenge was around addiction and all of the issues connected with that. They really wanted to do something about it. And not only were they motivated to do something and already fielding requests for support, but they were also looking for partners and accompaniment in developing this program that they wanted to create. And so they kindly invited us into that. And essentially that was the pilot for BRIO. It was based on asking the question of what kind of strategic support, knowledge support, leadership support, and accompaniment might help to build these contextualized models of care alongside community leaders who really have their finger on the pulse of what the challenges are.
Thanks so much for sharing. So would you share with us a little bit about your venture's journey and any big milestones that you've hit? And then where do you see this going in, say, the next 5 years?
So when we first started, we had this idea to figure out what kind of support was necessary in order to build community-owned models of care alongside community organizations. And so back in 2018, when we received the Innovate Health Yale Prize, that was the very, very early stages of creating what BRIO would become. And so over the course of that first pilot partnership with the group in Ecuador, we helped to design and strategize the first mental health addiction counseling training that was available to low-income leaders in the country of Ecuador. And it moved really quickly. There was a lot of momentum back then before the world of COVID. And they were able to train 50 leaders by the end of the first year, who then delivered more than 2,000 hours of care for free or low cost. And so what we sort of realized was that there is so much potential, and yet there were also ways in which we had supported and accompanied and just strategized alongside them that were really valuable to building this success and momentum. And so we, by invitation, were invited to work with a few other organizations, also in Latin America, in Mexico, and in Peru, that were tackling the mental health challenges that they felt were the most pressing needs facing their participants. And really, our partnership program grew from there. We looked at the particular areas of the design process that might be helpful to contribute, specific design thinking exercises, ways in which we might use research and evaluation, both at the beginning and in the middle and at the end of really understanding the problem in a way that is highly localized. We looked at ways to involve participants from the very beginning and to develop that sense of ownership through these organizations and their existing networks of engaging local participants. And so now we have partnerships across multiple continents, and it's really exciting and also humbling to constantly be learning about cultural contexts, about experiences, about the social determinants of health in those particular communities. But I think that we're really growing in our ability to be agile and responsive to the needs of the organizations we're serving. I would say that in the coming handful of years, we're looking to expand our partnership program to bring on more staff that can serve them in a consultative and evaluative role. We're also having opportunities to work with some teams on actually strengthening their team capacities and resiliences as they're doing a lot of really challenging frontline work. And so we're really becoming more global and more tailored to the kind of support that is needed in building these really transformational models.
Thank you so much. It's really amazing to see this project, this venture evolve from the very early stages to where you are now. It's been really exciting to see that growth. So can you share with us a little bit about how Innovate Health Yale and the Yale innovation ecosystem in general supported your work and what role they played?
I would say that there's so many ways in which entrepreneurs need support, and Innovate Health Yale played a really key role in that. I think the first is actually just signing on and saying, we believe in your vision. When you're first starting out, particularly working on problems that have been named as completely intractable, impossible, it means so much to have that vote of confidence to say, like, we want to give you what you need to just try something and see if you can learn by doing. I think I love that quote of just start and let the work teach you. And I think that that is the posture that the program gives. But then also, here are a bunch of people you can talk to who might give you wisdom and insights into how to actually approach this work. What is already being done that you can learn from, and what are some of the key questions that people have yet to answer, and how might you contribute to that? And so I would say that being able to connect with faculty at the School of Public Health, at the med school, PhD students doing research in similar areas, and also just having that feeling of, yes, like, this is entrepreneurship, but you're not alone. You can reach out and you can ask and just process everything that you're learning with a community of folks that really care.
Thanks for sharing. So what are one or two pieces of advice you would give to future entrepreneurs?
I think that my first piece of advice is that entrepreneurship is about starting and it's about taking on a really big challenge, but it's also about perseverance and finishing. I think that it's so easy to fall for the fanfare of being someone who's starting something brand new, of being disruptive, of breaking industry barriers, and these things are really exciting. And then at some point you come to the reality of like, there's a reason that these systemic barriers exist. There are huge forces that are affecting the populations that you hope to serve, and you have to come up and face them every single day. And so beyond that first big splash, like knowing that you know, your vision really matters, and the hope that you have for your cause really matters and will carry you beyond all of the initial excitement into the nitty gritty, the grunt work, pushing through challenges, getting back up after you fail, and just really believing in your vision and becoming a champion for it.
Thank you so much.